You trusted the test because your doctor ordered it. That's what almost everyone does. But after working with older adults for more than 2 decades, I've watched healthy people walk into a clinic for a routine screening and walk out trapped in months of fear, procedures, medications, and complications they never needed in the first place. And here's the disturbing part. Sometimes the test itself wasn't the thing that helped them. It was the thing that started the damage. Today I'm going to show you 4 common medical screenings many adults over 65 should think twice about before agreeing to, because in the wrong situation, these tests can create more harm than protection. And the 4th one. That one shocks even cardiologists sometimes. Quick medical disclaimer before we continue. This video is educational only and not personal medical advice. Every person's situation is different, so always talk with your own doctor before changing medical decisions. Now here's the thing most people never hear. Medicine is incredibly good at finding abnormalities. But finding something does not automatically mean it needs to be treated. That difference becomes critically important after age 65. Because aging bodies are different. A tiny abnormality that means nothing at 72 can suddenly trigger a chain reaction of scans, biopsies, medications, surgeries, side effects, falls, and hospital visits, simply because the medical system is designed to keep investigating once something appears on paper. Doctors even have a term for this. It's called the medical cascade. And if you remember nothing else from this video, remember that phrase. Let me explain how it works. You feel perfectly fine. You go in for, just to be safe, screening. The test finds a shadow. Or a spot. Or a number slightly outside the normal range. Now your doctor orders another test. That test finds something else, possibly concerning. Now you're referred to a specialist. The specialist recommends a procedure, just to rule things out. Then suddenly, complications happen. Maybe dizziness from medication. Maybe bleeding after a procedure. Maybe anxiety and sleepless nights. And 6 months later, the person who originally felt healthy is now weaker, overwhelmed, and managing multiple new medical problems that never existed before that first screening. I've seen this happen more times than I can count. Not because doctors are bad people. Most genuinely want to help. But modern medicine often struggles with one question. When should we stop looking? And older adults pay the price for that uncertainty more than anyone else. I once treated a woman named Margaret. Not her real name, of course. She was 74. Sharp mind. Independent. Still gardening every morning. She went for a preventive screening she didn't even want originally. Her daughter encouraged her. The test found something tiny. Probably nothing. But probably is enough to trigger the system. More scans followed. Then a biopsy. Then medication. Then dizziness. One fall later, she fractured her hip. And during rehab she looked at me and said something I still think about today. She said, "Doctor, if I felt fine before all this, why did everything suddenly become so complicated?" That question changed the way I practice medicine. Because most older adults are never told this, the goal of medicine is not to find the most things. The goal is to help you live longer, stronger, and more independently. Sometimes those are not the same thing. And now we need to talk about the first screening. Because this one has exploded in popularity among health-conscious seniors. Full-body CT scans. You've probably seen advertisements for them. Catch hidden disease early. Scan your entire body. Peace of mind in one appointment. Sounds smart, right? Honestly, it sounds amazing. But for many adults over 65, these scans open the door to unnecessary fear and procedures. Here's why. As we age, the body naturally develops harmless little abnormalities. Tiny lung nodules. small kidney cysts, benign liver spots, mild spinal changes. Most findings do not cause issues. Court scans report all, without knowing emotional impact. Doctors must follow up on reports. Repeat scans can increase radiation exposure and anxiety. Biopsies, especially post-65, carry risks, like bleeding or kidney stress. Abnormalities might not harm patients. More findings don't ensure longer life. Medicine is complex. Sometimes seeking answers can create danger. Minor issues may lead to risky treatments. Consider these factors before screenings. If you value this video, subscribe. It guides you through medical advice for aging. Our channel empowers smarter questions on screening risks. Let's talk about bone density scans after age 80. Before anyone misunderstands me, bone health absolutely matters. Hip fractures can change a person's life overnight. But here's where things become complicated. A bone density scan doesn't prevent falls. It only measures bone thickness. After age 80, the bigger danger often isn't weak bones alone. It's balance problems, medication side effects, poor vision, muscle weakness, loose rugs, dark hallways. That's what actually causes many fractures. But many older adults get a DEXA scan, it shows osteoporosis, and immediately the conversation turns to medication. Here's the thing, some osteoporosis medications can help certain people. But in very elderly adults, they can also create serious risks, jawbone problems, digestive complications, rare but dangerous thigh bone fractures that become incredibly difficult to repair. And meanwhile, nobody ever addressed the actual fall risk inside the home. I once visited an 82-year-old patient after she fractured her wrist. You know what caused it? A sleeping pill made her dizzy when she got up at night. That single medication mattered more than the scan result. Smart prevention after 80 often focuses on balance training, safer walking conditions, medication reviews, vision correction, and strength exercises. Preventing the fall is usually more important than chasing a number on a report. Now, carotid artery ultrasounds. These look for narrowing in the neck arteries that supply blood to the brain. The logic sounds perfect: find blockage early, prevent strokes later. But the reality is more nuanced. Once narrowing is discovered, many patients are pushed toward procedures designed to remove the blockage, and those procedures themselves can trigger strokes, especially in older adults. If someone already had stroke symptoms, that changes the equation. But in healthy adults with no symptoms at all, the benefits are far less certain. Sometimes careful blood pressure control, cholesterol management, walking, diet, and medication adjustments provide similar protection with far less risk. A finding is not automatically an emergency. And finally, routine cardiac stress testing in people with no symptoms. This happens constantly. Someone turns 65, gets a stress test, just to check the heart, no chest pain, no shortness of breath. Then the test comes back slightly abnormal, and suddenly the patient is discussing cardiac catheterization. Catheterization can save lives in the right situation. Active symptoms are a true emergency. But in symptom-free adults, things get complicated. Catheterization is invasive. A tube enters an artery, contrast dye is injected near the heart. Complications, bleeding, kidney injury, stroke risk, arterial damage, are uncommon but real. Landmark studies found something surprising. For stable patients without major symptoms, aggressive procedures often did not outperform excellent medical therapy alone. Medication, lifestyle changes, blood pressure and cholesterol management, when it came to preventing heart attacks or extending life. That doesn't mean procedures are bad. It means context matters. After age 65, every medical decision should include one question: if this test finds something, what happens next? More scans. biopsies, medication, surgery? And will those interventions genuinely improve your quality of life, or simply create more medical complexity? That single question changes everything. Please hear me carefully. This video is not telling you to avoid doctors. Preventive medicine saves lives. Blood pressure control, diabetes management, vaccinations, vision and hearing checks all matter. The point is informed decision-making. So next time someone recommends a screening, ask, what exactly are we hoping to change with this test? That question alone can protect you from unnecessary procedures, stress, and complications. Now it's your turn. We're eager to hear your stories about unexpected medical journeys. Did a seemingly minor procedure lead to a flurry of tests? How did that impact your life? Join the conversation below and let's share our experiences together. What surprised you most? Thank you for sharing your insights and experiences with us. Your stories can be powerful reminders of the complexities of healthcare, helping others navigate their own journeys. Stay engaged and continue to support one another as we explore the nuances of these unexpected medical challenges. And if this video helped you think differently about your healthcare, subscribe. The best medical decisions happen when patients are informed, calm, and confident enough to ask the right questions.